Hello all, welcome to the second part of cardiac medication part 1. We're going to cover the other half of the hypertensive medications. Okay, here are your objectives. As mentioned before, please take a look at them. And also I want to stress the nursing practice application section at the end of each chapter of your book. So as mentioned before, we talked about hypertension being a major risk factor for CAD, coronary artery disease, cardiovascular disease, and can also lead to stroke, death, and heart failure. So knowing your normals for your diastolic and systolic is helpful. Hypertension management. Again, we have non-pharmacological and pharmacological measures. So initially, teach a patient diet, exercise, lifestyle modification, decrease sodium intake, decrease stress. If that's not possible, then they would need to go on pharmacological treatments. So last recording, we covered diuretics, ACEs, and ARBs. So this time we're going to cover calcium channel blockers, adrenergic drugs, vasodilators. Calcium channel blockers are the extension of the drugs endopines. They basically block calcium on the peripheral vessels. Their calcium channel is used to treat angina, dysrhythmias, hypertension, and help reduce blood pressure by causing the muscle to relax. So if you think of calcium, you think of warm milk, it relaxes the muscles and the vessels. The calcium channel blockers in combination with diuretics have been shown to be effective in African American patients who have hypertension. Serious adverse effects of calcium channel blockers. If it's used to treat hypertension, the adverse effect is hypotension. Just go to the extreme. Fatigue, headache. A lot of people complain about having a lot of peripheral edema. It can also affect your electrolytes. It's used to treat dysrhythmia, so adverse effect would be again dysrhythmias. Some GI upset is also common. Our next drug, vasodilators, they act directly to relax the arterial and the venous smooth muscle, and it causes vasodilation, and it causes a drop in blood pressure. In your Adams book, 26.8 is the table. You could find your list of vasodilators. So basically, the adverse reaction would be dizziness, headache, tachycardia because of the drop of blood pressure, dyspnea, vomiting. One of the drugs, which is a vasodilator, is minoxidil, hydralazine. These are all examples of direct vasodilators. Adrenergic drugs, this could be found in table 26.7. So specific, there's 5 categories of adrenergic drugs. You have central acting and peripheral acting. So you have alpha 2 and alpha 1 blockers, and you also have your beta blockers, which acts peripherally, and alpha 1 blockers with beta receptors, which also acts peripherally. So these are your adrenergic blockers. These drugs work in the periphery, which is your alpha 1, your doxazosin, prazosin, terazosin. They all modify the sympathetic nervous system. They do so by blocking alpha 1 receptors. When these are blocked, blood pressure decrease. Beta blockers work in the periphery. These are drugs like propranolol, metoprolol, atenolol, and these have antihypertensive effects related to reduction in heart rate, which is beta 1, and it also decreases your renin hormone. Adverse effects of adrenergic drugs. It does affect your heart rate, so bradycardia and also rebound tachycardia would be one of your adverse effects. Orthostatic hypotension in patients taking alpha blockers. So you want to tell them to change position slowly. And these drugs have something called first dose syncope. So basically, on the first time they take this medication, you need to teach them safety because they can get up, faint, and pass out. So because of the vasodilation. So educate the patient to change position slowly. Do not stop the drug abruptly. It has to be weaned off because it could give you a rebound hypertension. Non-selective blocking drugs are also commonly associated. What we mentioned, the beta blockers, non-selective, would also cause bronchoconstriction. Again, first dose syncope, which is person can faint and lose consciousness. Let's review some questions. Okay, so the nurse should question the prescription for a calcium channel blocker in a patient with which condition? So, who would you not give a calcium channel blocker to? And the answer would be somebody who has hypotension, because it would cause more hypotension, but everything else is appropriate. The nurse is conducting a community education program when explaining different medication regimens to treat hypertension. It would be accurate to state that African Americans probably respond best to which medication. So as mentioned, diuretic, first line for hypertension, also a calcium channel blocker. African Americans do not respond well to ACE inhibitors, but calcium channel blockers work well, and diuretics work well for African Americans. Here's our third question. What is the classification of Carvedal? So remember, look at the end of your word, OL, and it's a beta blocker, but that one is also a dual action. It's an alpha 1 and a beta blocker. And our last question is a select all to apply. When teaching a patient about a new prescription for Carvedal, Coreg, the nurse explains that this medication reduces blood pressure by which action? So Carvedal, it's a beta blocker, so it reduces blood pressure by A, decreasing the heart rate, and also D, it causes peripheral vasodilation. So remember, it works both ways. It's the alpha 1, and then it's also a beta blocker. That's one of our dual adrenergic medications. So those are the two ways it works. And happy studying. Thank you, and I'll see you on the next recording.